Hi, my name is Rachel Johnson, and this is a presentation about bipolar disorder. So bipolar disorder is a mental illness in the DSM-5, which is the Diagnostic Statistical and Manual for Mental Disorders. It's the 5th edition, which is the newest edition. And in this manual, it describes every mental illness that there is that medical professionals use to diagnose their patients with. It lists all the criteria for having this illness. And so for bipolar disorder, it consists of basically 3 types, which is manic episodes, hypomanic episodes, and depressive episodes. And I will get into that in just a minute. So there's 3 types of bipolar disorder. Type 1 is the most severe and has full manic episodes and depressive episodes. Type 2 has hypomanic episodes, which is a slightly less severe form of a manic episode, and then full depressive episodes. And cyclothymic disorder is the least severe and has hypomanic episodes and more mild depressive episodes. So for adults in the US, 4.4% will have bipolar disorder in their lifetime, and this percentage is about equal for males and females. And 82.9% of these people have serious impairment to their lives because of this disorder. And you can see that on the chart below, that the series is most of that circle, the light blue, and this is the highest percentage for all mood disorders for this high impairment. So this disorder severely impacts people's lives. And adolescents, 2.9% of adolescents have bipolar disorder. Most people are diagnosed in their early 20s, so that percentage obviously will get higher after adolescence. And again, 2.6% of adolescents with bipolar have severe impairment, again, so a very large proportion. And in adolescents, it's actually more likely that females will be diagnosed than males. So getting to the symptoms, mania, like I said before, is it's an abnormally and persistently elevated or irritable mood and increased activity and energy. So this is, again, the person has extremely high energy. They have a very reduced need for sleep. They often do very impulsive actions, and their mood can be very high and grandiose, like they think that they can do anything, that sort of thing. And also irritable, which their mood can be very kind of erratic. And this full mania is only experienced in bipolar type 1, and then hypomania, which is the less severe form, but still with the same symptoms, just not quite as over the top, would be for people with bipolar type 2 or cyclothymia. And this chart on the right also shows kind of the range of these different types of the mania and depression also. And so depression is... The symptoms include having a depressed mood, so very low, sad, or just the lower, like your moods are kind of flattened, I would describe it as. People have a diminished interest or pleasure in previously enjoyed things. They can either gain or lose weight without trying to do that. They can have insomnia, like they can't sleep, or just have like an excessive need for sleep and sleep for hours and hours a day. Loss of energy, they're less able to concentrate, and they can have thoughts of death or suicide also. So the diagnosis, a person would have like a psychiatric assessment with maybe a therapist or a psychiatrist or even a doctor, just a general practitioner maybe. And they would use that DSM criteria with all of the symptoms listed in it and the specific needs or the specific requirements that those symptoms need to be filled to diagnose that person. And a high percentage of bipolar patients are also diagnosed after being hospitalized for possibly a suicide attempt or being in a manic state and, doing something impulsive and dangerous that gets them into the hospital. And so for treatment, this is a lifelong condition that would need continuous long-term treatment. Most of the time medications are prescribed to balance moods. A lot of times antidepressants are avoided because for some people, if they have bipolar disorder and take antidepressants, it can actually cause a manic episode. So a lot of times those are avoided, but there's other medications to balance people's moods. And then psychological treatment like therapy, counseling, that sort of thing, to help them through the whole process of going through this illness. And yeah, that is my presentation. Thank you so much.